you have with me the Acting Director of Health Services, Dr. Mustafa Bitey, who will be delivering the report on behalf of the Honorable Minister. So I welcome you all, and you will have Doctor with the briefing. After finishing his statement, we will be taking few questions if you have any. So, Doctor, you're welcome.
Thank you. So, good afternoon, ladies and gentlemen. This, again, is to update you on the most recent developments regarding our response to the COVID-19 outbreak in the Gambia. The following are the updates since the last one, which was yesterday, 3rd April 2020. So 5 laboratory test results have been received from the laboratory, and they were all negative. This has brought the total number of laboratory tests done to 134. 102 individuals completed their mandatory 14-day quarantine and have been discharged. In total, this number of the total people quarantined and discharged is now 212. A total of 233 contacts have been traced, and since the beginning of the pandemic, the country reported a total of 4 confirmed cases, 2 of whom recovered, 1 passed away, and 1 undergoing treatment. There's a total of 36 people in quarantine now. It includes 1 new one. And the new one is an EU citizen who sneaked into the country through one of the land borders and is now put under mandatory quarantine. The number of confirmed cases still remain at 4. As of 3rd April 2020, our only neighbor, that is Senegal, has recorded 195 confirmed cases. This is the 7th highest in Africa. It is now recorded in about 45 countries or territories in Africa. And Africa has recorded a total of 5,632 confirmed cases and 164 deaths. Globally, a total of 972,303 cases of COVID-19 have been reported. Of these, 50,321 deaths were registered, thus having a crude fatality rate of about 5%. Every one of us has a role to play in combating this war. Every Gambian or resident of the Gambia, family and business can make the difference in stopping this virus. The public is once again urged to play its part by reporting any suspected cases through our toll-free lines on 1025. We will, at our end, continue to engage media platforms in the dissemination of sensitization materials and credible information. It is everyone's personal duty to obtain information from credible sources, such as in the Ministry of Health or WHO's website. The more we commit ourselves to this fight, the better for everyone. Let us rest not on our laurels. There is a lot of work to be done, and it is better to take hard measures now to prevent the disease than to try to catch up with very deadly disease. The lack of new cases should not make us relent in this fight. Finally, to all our partners and the many personnel of the Ministry of Health who have been working day and night to ensure we adequately respond to this global pandemic, thank you all very much, and continue to do the good work. To the Gambian people, we say thank you for your patience and vigilance as we go through these trying times together. Thank you for your kind attention.
Thank you, Doctor. Thank you very much. Okay, that was Dr. Bitey's statement on today's report. So now we will like to have 3 questions. So, yes, You state where you from and then your question.
Okay, I am from Gambia Connect. The question I yesterday, 63 members who were on quarantine were released to go back to their families. So are you guaranteeing us, or are you 100% sure that these people are totally free from those lives?
Yeah, so you, I think the Gambia, we are always doing extra. We are doing more than necessary always, just to be sure and to be, to be more certain. Because if you go to other countries, the quarantine, the essence of the quarantine in other countries, for example, is they put you under quarantine and then they check. If you have symptoms, they test. If you don't have symptoms, after some time they release you. That means that most likely you don't have the disease. But in Gambia, we don't stop at that. You are put under quarantine, strict, you are observed, and even before you leave, you are also tested again to be sure, just to be sure. But most people are saying that may not even be, in other places they don't do that. But you go to other countries, they also do a lot of testing. So that's why we are trying to do that, just to be more strict and to be more certain that what we are doing is better. So we are definitely telling you that, yes, these people should be considered 100% safe. But that doesn't mean that they cannot have reinfection. They have to continue to be careful and continue to observe social distancing. So by saying that, I'm not saying that you take those people to be safe. What you do is everyone in the society, including yourself, you should take everyone to be someone with coronavirus. So that's how you behave, so that you observe social distancing. You understand? But don't say, oh, somebody is safe, then I have to go and hug them. No. So treat every individual in the country as someone who has coronavirus. If you do that, then you will do prevention, good prevention.
Thank you. Yes, Lamin.
Yesterday, the National Assembly have passed the state of emergency that the executive requested from them, but reducing it to 45 days. Why such is really needed in the country? Because many believe that in as much as we have 2 cases earlier and everything is going normal as expected. Why is it really necessary that such should be? At least the country should go in for at least 45 days state of emergency.
Thank you for the question. So this is a general mindset that is developing in the country, and we are really worried about it. Because even if you see because of these days, we are not reporting any new cases, any confirmed cases. You can see that the people are becoming complacent. The number of calls have gone down. People are relaxing. And our message is, this is the time to act. This is the time to be more decisive. This is the time to take the hard decisions. And I think what the National Assembly is doing, they are leading that. They are showing that you don't wait until you have cases, you don't wait until you have many cases before you start acting. And I think what they've done is to show that they are decisive, is to show that they are acting now, is to show that they will not wait until we have so many cases before they declare this state of emergency. So we really welcome that. And this is the advice we are giving, that we have to act now. Let's emphasize the social distancing now. What the National Assembly did, we welcome it. And I think you should help us also in the media to tell the people that this is the time to act. You don't wait until you have cases, then you start acting. Because this, when it comes, it can be exponential. Because it's a respiratory disease. You may not have 1, 2 following order. You may have 10, then next minute 50, then you are going to hundreds, thousands, quickly like that, because it's exponential. And so this is the time you can tackle it easy. When the numbers are small, you take them and you deal with them easy. But when the numbers are big, it's a big problem, because then like we know, it will overrun everybody will be sick at the same time. And so you will need the doctors all at the same time. You will need all the beds at the same time, even more. And so we are running away from that. So that's why we are saying we are very happy with the measures that are taken by the National Assembly. because looking at all the projections that we've seen, we know that if action is not taken, if this type of measures is not taken, from the projections we have, like looking at the number of cases that will need beds, that will be admitted, from all the other countries, what has happened, and in Africa, looking at the number of cases, let's say, that will need critical care. If you do the projections and you don't have this social distance, you don't have these measures, the number of cases you will have at a time can be very high, especially when we reach the peak of the epidemic. So that's why we are saying take these measures now, because we make projections, we are planning for those projections, but we know that if intervention is done, we will not reach that level. And we understand, especially yesterday from the debates in the National Assembly, there are a lot of other factors that need to be taken into consideration, but first, let us survive it. We have to survive first, and then, we'll work with all that. But yesterday, a lot of discussion has been made to ensure how we will make sure that social protection and the weak and the poor are also taken on board during these processes. So this is what we know. We know that what the projections have shown that it can be meek in the peak of the. So these are estimates. Time in December, and I think early February or late January, we are called at the National Assembly. We went to brief the National Assembly Select Committee. We did a lot of things. I remember one of our example, you have health workers, soldiers, just like in times of war. They are ready to sacrifice their life to save people and themselves and their families. They sign up for that. But now they are going beyond the call of duty. For example, a normal routine would have been to work 8 to 4. But now they will work far more than that. Even, they are supposed to have off days. But because of the exigency of the situation, they have to work extra hours. And, so they have to take more sacrifices. And it is just sort of like a gesture to say that all what you are doing is appreciated. You go to other countries, right now in the morning, people go to where the doctors are who are serving them, or the nurses, or the orderlies, the health workers. They go every morning and clap for them. They can stand 1 hour clapping for, because they appreciate what they are doing. This is not only in Gambia. Most other countries are giving honorarium to their frontliners who are fighting this war. It's just an encouragement, because, for example, right now, the Minister of Health, people work almost, you come here on a Saturday. Every day people are working, and they are working till late. So this is the reason. And this has been suggested by many people, including the National Assembly. I can remember when we went there. So it is not that the Minister of Health is going to eat the money, no, at all. And I think very soon you will see what the Minister of Health is ready to procure from all these resources to ensure that all the health facilities and our plan and our response is well funded first. But this is, I think, just a gesture, a honorarium, as it is called, for these health workers who are doing a lot of this work.
Thank you very much, and have a good day.
Thank you. Thank you very much. Sorry, yeah?
Yeah, it's a pleasure.
alhamdulilah mbokk yi lii nga xam ne moom mooy Covid 19 bii mi ngi lëmbee àdduna si yëpp mu am solo pour ñëpp xam ne lu am la am na ba tax na la ñuy wax naka jekk mooy bul loru waaye bul nangoo lore li nga bëggal sa bopp ci mucc na nga ko bëggal sa morom ci mucc bu ko defee ñun ñëpp ñu ànd mucc mbir la moo xam ne nag lañ ci wax dëgg-dëgg mooy jëfe ndigal yi bàyyi tere yi mi ngi war a jóge ko ci ñi nga xam ne seen xam-xam màcc na ci wàllu faj moom mooy docteur yi nee nañu di raxasu waxtu bu nekk nee nañu moytu mbooloo yi daje dañ koy joxante foofa gis nga doomu jàngoro bi nekkul luy dox nit ñee koy toxal mu jógee ci nit dem ci nit kon loolu moo tax ñuy wax ne nañu moytu ndaje bi ak ndaje bu mu mënti doon dañu wax ne daw bëri ci kat ci njàmbaar la bokk kon nañu góorgóorlu nañuy raxas suñuy loxo nañuy moytu daje yi ngir yàlla ak yonent ba képp koo xam ne nag gis nga sa bopp lu mel ni socc wala saqat ak yu ni mel mën ngaa woo 1025 nombre boobu moom ngay woo ñu wax la loo xam ne daa aju na ci li lay dimbale incha allah rabbi yal nañ mucc de asalaamaaleykum wa rahmatulah